My name's Molly Curtis and I'm a PhD student at the University of South Wales. My project is developing and testing a compassionate care measurement tool. The project's being conducted in partnership with Torfaen County Borough Council. It's part of the CARES 2 programme at the University of South Wales, part funded by Torfaen County Borough Council and the European Social Fund. The literature suggests that existing measures for compassionate care have mainly been developed in the context of acute healthcare settings in the United States. A review of these measures suggests that they are limited and may not generalise to other contexts. Due to this gap in the literature, the aim of my project is to develop a tool to measure compassionate care, which is based on the perspectives of older people, carers and service providers in the context of both health and social care services in the UK. In this presentation, I'm briefly going to discuss how I've defined the concept of compassionate care using a group concept mapping method, how I've used the results of the group concept mapping study to develop the tool, the pilot testing of the tool, and the next steps where the tool will be refined and tested in practice with service providers. The importance of providing compassionate care is well documented in the literature, as well as in policies and guidelines for health and social care services. The literature suggests that compassionate care is a priority for research, policy and practice, not only in the UK, but also worldwide. However, there is a lack of consensus about how compassionate care is defined and understood in practice. To address these issues in defining compassionate care, I used a group concept mapping method with older people, carers and service providers to gain an understanding of their perspectives of compassionate care. I used a combination of in-depth interviews, face-to-face workshops and online tasks. Group concept mapping involves 3 participant-led tasks, these being brainstorming, sorting and rating. Initially, I conducted in-depth interviews with frail older people receiving residential, nursing or domiciliary care. These interviews fed into the brainstorming task. During the brainstorming task, older people, carers and service providers were asked to generate as many ideas as possible in response to the study focus prompt. The focus prompt was, if being compassionate is showing you care, I know someone's being compassionate when they, or I know I am being compassionate when I. Following the brainstorming task, participants were asked to sort a collection of 89 statements from the brainstorming task into categories which made sense to them, and they were asked to give each category a name. Following the sorting task, each participant was asked to rate every statement based on how important they believed it to be and how frequently they experienced it in the care they receive or provide. The aims of this group concept mapping study were to identify the key elements of compassionate care from the perspectives of older people, carers and service providers, to produce a conceptual framework of compassionate care which represents the perspectives of all participants, and to use the results further to develop a tool to measure compassionate care. Data from the sorting task were analysed using multidimensional scaling and hierarchical cluster analysis to produce a cluster map representing compassionate care. The project steering group agreed that compassionate care is best represented by an 8-cluster map. The cluster labels were either originally generated by participants during the sorting task or agreed by the steering group during the analysis. From the perspectives of older people, carers and service providers, compassionate care involves being non-judgmental, having excellent skills which set them apart, going above and beyond, genuine caregiving, showing the person is valued, being empathetic, being thoughtful and providing people-centred care. Within each of the clusters on the map are a number of statements generated during the brainstorming task. Statements which are closer together on the map were deemed to be more similar by participants during the sorting task. Previous studies have shown that the results of a group concept mapping study can be used to measure the topic of interest. I used the results from my group concept mapping study to develop a tool to measure compassionate care. Developing the tool involved creating the initial item pool. These items were selected from the resulting group concept mapping statements. 40 items were selected in total, 5 from each of the 8 clusters. Statements representing the anchor point within each of the 8 clusters were selected, as these are thought to be a good representation of content within their vicinity on the cluster map. I created 2 versions of the tool, a simple 7-point Likert scale and a thermometer style 5-point scale. This slide shows some examples of items which were initially included in the tool to measure compassionate care. Each item was a statement generated by either an older person, a carer, or a service provider during the brainstorming step of the group concept mapping study. The table shows the corresponding cluster in which each statement or item came from. The items included in the tool are written in the participants' exact words, such that the tool to measure compassionate care represents the voice of older people, carers, and service providers. The tool was then pilot tested with health and social care staff and students from the University of South Wales. Data collection initially took place in the Hydra Minerva simulation suite at the university. However, due to COVID-19, the remainder of the data collection took place online, so through Microsoft Teams, Skype, or via telephone. Participants received training materials explaining how the tool was developed and how to use the tool. Both versions of the tool, so the simple version and the thermometer version, and some demographic questions. Participants first took part in a rating task. They were asked to watch a video of a social care provider interacting with older people and to reflect on their own experiences of providing care. They then completed both versions of the tool. Finally, participants took part in either a focus group or individual interview, in which they discussed their experiences of using the tool. The questions within the interview guide focused on the usability of the tool. Focus groups and individual interviews were audio and video recorded. The data from the pilot test in focus groups and interviews are currently being transcribed. The data will then be analysed using thematic analysis in order to identify any themes that come up across the focus groups and interviews. These findings from the pilot test will then be used to refine the tool to ensure it has good face and content validity prior to testing in practice. Testing the tool in practice will then involve discussing any amendments to be made to the tool with the project steering group prior to gaining ethical approval. The tool will then be tested with participants who have experience of providing care for older people. This may include social care providers, health and social care staff and students, or members of the public. Unfortunately, due to COVID-19, we are unable to test the tool with healthcare providers as we initially planned. The responses from testing the tool in practice will be statistically analysed to assess the validity and reliability of a novel tool to measure compassionate care. The impact of this will hopefully be to address the gap in the literature and to produce a tool which has been developed from the perspectives of older people, carers and service providers in the context of both health and social care services in the UK. Thank you for listening to my presentation. Please feel free to get in touch with me if you have any questions or would like to discuss anything further.